Good day, ma'am. I am Marquisha Chloe Limyak, and today I'll be demonstrating the procedure for giving a bed bath. This procedure is done to maintain the patient's hygiene, promote comfort, stimulate circulation, and prevent skin breakdown and infection. I will follow the proper steps and safety guidelines to ensure the patient's safety and dignity throughout the process. First, I will review the patient's chart to check for any physical limitations such as restricted movement, injuries, or conditions that may affect the procedure. This is important to prevent discomfort, injury, or harm to the patient during the bath. Next, I will gather all the necessary equipment and bring them to the bedside, including clean gown, bath blanket, washcloths, basin, warm water, towels, gloves, and other supplies. Before starting, I'll perform proper hand hygiene and put on gloves as needed. Hand hygiene is used for personal protective equipment, help to prevent the spread of microorganisms and protect both the patient and myself from infection. I'll close the curtains around the bed and close the door to the room if possible, and adjust the room temperature if needed. This protects the patient's privacy and helps prevent from getting cold or losing body heat during the bath. I will start by washing the face with plain warm water, using a different corner of the washcloth for each eye, wiping from their inner to outer canthus, and I'll wash the neck, arms, axillae, and hands, paying attention to the skin folds. Using a different corner of the washcloth for each eye, wiping from the inner to outer canthus. Next, I'll wash the chest and the abdomen, then the legs and feet. For the perineal area, I'll wash from front to back to prevent the infection. Finishing up, I'll dry each area thoroughly to prevent skin breakdown. I'll change the water if it becomes cold or dirty. After completing the bath, I will remove my gloves, perform hand hygiene, and reposition the patient comfortably. I will make sure that the bed is neat and the patient is warm and safe. The next one we have is shampooing. So first, I will gather the supplies including shampoo, bath basin, pitcher of warm water, washcloths, towel, bath blanket, and waterproof pad. I will place the waterproof pad under the patient's head and shoulders to protect the bed. I will adjust the bed height and position the patient on their back with their head near the edge of the bed. The waterproof pad prevents the bed from getting wet. Proper positioning makes it easier to perform the procedure safely. I will place the bath basin under the patient's head, positioning it so the water flows into the basin. I will wet the hair thoroughly with warm water. I will apply shampoo, Gently and massage the scalp with my fingertips. I will rinse the hair completely with warm water, pouring the water slowly from the pitcher. Massaging the scalp improves blood circulation and removes dirt and oil. Rinsing thoroughly prevents shampoo residue from irritating the scalp. Finishing up, I'll remove the basin and dry the hair gently with a towel. After drying it with a clean towel, I can use a hair dryer on a low setting if needed. After drying, I'll remove the waterproof pad, reposition the patient, and clean the area, and after, I will perform a hand hygiene. For the next procedure I will do is the oral care. So for this, I will gather first the supplies like toothbrush, toothpaste, mouthwash, basin, towel, gloves, and water. I'll position the patient in a sitting position if conscious or a side-lying position if unconscious. I'll place the towel under the patient's chin and the emesis basin near their mouth. Proper positioning prevents choking or aspiration. The emesis basin catches saliva and water, keeping the patient clean. After I put gloves, I will wet the toothbrush and apply a small amount of toothpaste. I'll brush the teeth gently in circular motions. Cleaning all surfaces, outer, inner, and chewing surfaces. I'll brush the tongue and gums gently. Then, I will rinse the mouth with water or mouthwash, using a syringe or a cup if needed. After the procedure of oral care, I'll wipe the patient's lips and face with a towel. Brushing removes food particles and preventing tooth decay and gum disease. Cleaning the tongue removes bacteria and bad breath. Rinsing ensures that the mouth is clean and fresh. The next procedure that we have is the back massage. So first, I will gather the supplies like lotion or oil, towel, gloves, and I'll position the patient on their side or prone position, exposing only the back area. I'll place a towel under the back to protect the bed. Proper positioning allows access to the back and ensure the patient comfort. I will apply a small amount of lotion to my hands and rub them together to warm it. I'll start massaging from the lower back using a long smooth strokes upward toward the shoulders. I'll use circular motions on the muscles, paying attention to the areas that feel tight or tense. I'll massage for about 3 to 5 minutes, applying gentle pressure. Massage improves blood circulation, which helps prevent pressure sores. It also relaxes muscles, reduces tensions, and promotes comfort and relaxation. Finishing up, I will wipe away any excess lotion with the towel. I will cover the patient and reposition them comfortably. And then I will remove gloves and perform a hand hygiene after.